I mean, the importance of Baby Lifeline is actually it's a very good brand. It's known out there as being a charity that provides help and support, both for obviously providing equipment and so on for in the NICU units, but also providing sort of generic training and for the good of the mothers and the babies. So it's a very attractive collaborating organisation for people to have. It's no other agenda apart from doing good. So that's one of its benefits. The other benefit Baby Lifeline has is that it has connections with a huge number of very talented, very able people who want to give time and effort to help with the development of the courses, because again it's seen as a good thing to do. Baby Lifeline's in a very good place at the moment because one of the main highlights of problems within the NHS has been looking at outcomes. This has been now it's focusing more and more on outcomes, and you know that the NHSLA report that's just come out has highlighted what most of us knew already, but it's quite significant problems relating to trauma to babies at the time of delivery, and the consequences of that from a medical legal point of view and the cost of that. But that's human tragedy as well. It's not just the money, it's the human tragedy of damaged babies. And we know an awful lot of that relates to poor working environment in some way, whether that's related to understaffing or overworked, or whether it's related to factors such as lack of training, lack of support. We know it's lack of communication, and most importantly, team working. And one of the things which, again, that you're been very good at is that not only training but around a particular subject, but training the team working around that, and seeing how that, okay, it's all very well you diagnose a problem in CDG, what do you do about it? How do you get the support and people to come there and do the rescue? We know that a lot of the problems relating to bad outcome relates to problems of the length of time it takes for the event to be diagnosed as occurring and the rescue of that event. So the shorter that distance becomes, the more likely that baby will be born well. And it's teaching people how to interpret, escalate, act, and communicate, which is what you've been trying to do in various parts of the training you have. And that's not something which is well trained at the current time within the NHS. So I think that Baby Lifeline has all the potential resource there. And it's done. You've run, 70 odd courses over the years. It's been a very impressive portfolio of work. One of the problems is the maintenance of these courses, the updating of these courses, and just the general structure. And as in all charities, you spend most of your money doing good things rather than thinking about how to actually keep the core working. And it's that core support which is so important to help them develop all the good things that you can do with the work you've done, and also the expertise you've got.
We are at Leicester conducting a CTG masterclass at the Leicester General Hospital in the Postgraduate Education Centre, which is a leading centre in East Midlands for maternity care. Leicester is, as I said, a leading centre for maternity services, including intrapartum care, and they provide excellent services for women and babies in the region. I think NHS as a whole organisation is going through a very difficult financial situation and climate at present. However, there is a lot of challenges with regard to training of midwives and obstetricians and staff in general. The way I look at this is that each baby with cerebral palsy currently costs £8 million for the NHS. In addition, there are emotional and social costs for their families. And therefore, in my opinion, every penny that is spent to train midwives and obstetricians to improve their CTG interpretation is money well spent, because overall it will save large amount of money for the NHS.
Here in Leicester we deliver 11,500 women a year within 2 hospitals, the Leicester Royal Infirmary and the Leicester General Hospital. Today I'm attending the Baby Lifeline CTG Masterclass. What's really important today is there's really quite a lot of us within the training day, which is great. It's an on-site study day within the Leicester General Hospital and it's multi-professional, and for me the midwives are all together, there's some networking going on and some great interaction.
As a supervisor of midwives, it's all about safety of mums and babies. One of the things we have to do is investigate midwives' practice, and one of the biggest reasons for poor practice that we've noticed just lately, in line with what Edwin said today as well, is CTG interpretation. So actually, for the midwives to come along today and attend the workshop, it's actually helping with their professional development.
This is clearly a very important topic for us when we all work as a team on the labour ward, and it's so important, like Edwin's told us this morning, that we have a multidisciplinary group of people working on labour ward, and it's so important also that we've gone back to basics, looking at why and how we interpret CTGs and what impact it actually has onto the perinatal morbidity mortality as well as our operative intervention rates, and therefore I think it's very important that we are here and very privileged to be on this Baby Lifeline CTG Masterclass today.
I think it's important because like Edwin said today, when you're in training, you're taught by health professionals rather than the actual science behind everything. It's really nice to actually come to the understanding of the science behind what's going on. So you're not looking at the CTG as the interpretation, you're interpreting what you're seeing. So rather than that being a diagnosis, you're thinking, okay, well, what's the reason behind this? What's the reason behind that? You're able to provide a rationale for your actions, and you're then able to exclude things, and like the consultant said, you can reduce the intervention rates as well. So it's nice for everybody to have that understanding.
Clearly we are a maternity unit, and as one of the maternal fetal medicine subspecialists, one of my jobs is to look after very high-risk mothers. What Baby Lifeline is obviously bringing into this for us is that it's looking at the safety, well-being of mother and baby. And clearly what Baby Lifeline's done as a charity is putting together a huge amount of effort into a time when resources are at a minimal, but clearly have benefited us as a group today.
Baby Lifeline has really made a difference because it's provided a sort of like a link between women and children and between healthcare professionals. At the end of the day, life does start in maternity. That's where everybody's born. So it's quite important to make sure that we get those things right from the get-go, so that people can live and we can reduce the incidence of maternal and infant mortality and morbidity. So I think it's really made a difference in that it's providing training for people, for staff members, particularly where the economic climate is. We don't have enough money for equipment, we don't have enough money for the training, but it's providing this training for the staff free of charge, and we're doing it together collectively. And I think it's really amazing that it's taken a mother to sort of cry out after her loss to get it going. So I really think people need to encourage it and push it forward, because it really, from my